Good afternoon, Cleve Denson, and we welcome you back here.
And it's nice to be back every year.
Every year you come.
Routine, yes.
You are one of our very dedicated patients.
Well, yes, that's why I came to India in the first place. You have to be dedicated, because it's a long way to come.
Good. First of all, I must congratulate you for this successful journey.
It's easy.
It's easy.
The journey, all the surgery.
Yeah.
I didn't have to do anything. It's all done for you.
The
surgery basically does it all.
Could you just put it in 2-3 lines? How was your experience? When was the surgery done?
Surgery was done 2009, I think it was May. So that's 6 years now. About 6 years to the month. And I did it for diabetes mainly. The losing weight was a bonus.
Okay.
As I said, the diabetes is in complete remission. HbA1c is 5, which is normal. It's less than my wife's, who is not a diabetic.
Okay.
And so, first objective achieved, and second objective, the bonus, all the weight has gone, and a little bit of work is needed to maintain it at this level, but it's very easily achievable.
Okay.
And it's all thanks to the surgery, there's very little.
What's your weight?
Weight now is, I have to convert it into pounds, the American audience, it's about 170 pounds. And it does fluctuate, but I aim to keep it around that or maybe a little bit lower, and it's generally not.
How much was it earlier before surgery?
It was 120 kilos. Which in pounds, you're probably more familiar with American pounds, but it's probably about 100.
It's about 300 pounds,
Yeah, whatever, 140, 280, probably about 270 actual.
Okay.
It's about 19 stone. You see, we work on stones in England, so it's about 270.
So now you're around 75 kilos, and earlier you were about 120
I was less.
kilos.
One stage, was really determined, and it went, well below that, about 5 or 6 kilos.
Yeah.
And I could easily achieve that.
Yeah.
But of course, as I'm approaching 60, it does show on the face,
You're approaching 60?
Well, I'm 60 on August 1st.
You don't look like 60.
Well, thank you. Some people do in the Philippines. They think I'm 75 because their hair, they never see white hair. Asian people dye their hair.
Oh, yeah.
But also, if you lose weight, it does show.
What about the energy levels?
Energy levels, I can walk for miles because you're not carrying all that excess weight.
Very good.
In Ludhiana, I'm walking around. I don't take rickshaws like the other people. I'm walking from shopping mall to shopping.
So how much you can eat in one
I can eat anything. I can eat a whole table.
Okay.
There's no restriction. Yeah, there's no restriction on that.
So how you control your weight? If there is no restriction after MGB, then how the weight is?
Well, if I ate normally without chocolate, I would maintain my weight. But I like to, eat chocolate, so I will put on weight. This won't stop you putting on weight. On the other hand, if you want to stay slim and you do want to eat forbidden foods, then you have to have a certain amount of dieting. But that's very easy because there's no hunger element involved.
So you think that the hunger element goes down,
well, it
but
disappears
restriction
completely.
is nothing big.
Yeah. No, you can eat normal meals, and if you want to overindulge, it will show. Don't make mistakes. It's not a magic formula.
Okay. Any incidents of bile reflux in these 6 years? Bile reflux.
Yes, bile reflux. Only if I eat just before going to bed, which you shouldn't eat anyway.
Okay, if you eat just before going to bed.
Yes, that's bad. No one should do that, and that's why 90% of cases of acid reflux is due to not leaving a significant amount of time before going to sleep.
So what do you notice? How much time you should have between dinner and your food and your going to bed?
Well, the recommendation is 3 to 4 hours, which I observe.
You observe that?
Yeah.
And you have no bile reflux?
No bile reflux.
No incidents of vomiting?
But if I was working a late shift at work, I'd come home, have a meal, and then go to bed. Yes, there's 1 or 2 occasions when I would get reflux. And once you've had reflux, it's a horrible thing.
But that was only 1 or 2 times?
Yes, that's only 1 or 2 things.
Okay. So there are some interesting facts which we are also learning. It's a never-ending process, as you know. We are doing MGB in India from last about 8 years.
Yeah.
And now more and more more surgeons are doing MGB and more patients want to do the
It's
surgery.
understandable. It's, to
Yeah,
me, it's a complete
yeah.
success. It's a
So
wonder.
if we compare MGB to Roux-en-Y, as now you have undergone this and you already had done a lot of research on this before coming to me here.
Yeah.
On the internet.
It looked
and-
so good, too good to
Yeah.
be true in actual fact, and in fact I found it to be exactly what
Yeah.
Dr.
So
Rutledge said.
let's go back to that time when you were comparing the surgery on the internet and have this. Could you show us the Roux-en-Y there? This is the Roux-en-Y.
Yes.
In Roux-en-Y, the pouch is 30 cc, and the outlet here, the outlet is about 1 to 2 centimeters.
Mhm.
So you can eat less, and whatever you have eaten, it doesn't go down easily. That's why we make the outlet tight.
All right.
And let us compare this to Roux-en-Y. Sorry, this MGB.
Mm.
In MGB, the pouch is big, at least 4 times that of the Roux-en-Y.
Yes.
And the most important thing, the outlet. Outlet is 5 centimeters. That is the reason why you do not have restriction. You can eat because whatever you eat, it goes down easily.
Mhm.
That is why you have less incidence of vomiting in MGB because it's going down.
Oh, I see.
You see the difference.
So with
And
the
the pouch is
Roux-en-Y,
big.
Roux-en-Y is vomiting because it can't get through the narrowed
Yes,
aperture.
in
It's
Roux-en-Y,
coming back up. Ah.
In Roux-en-Y, just go back to Roux-en-Y again, the pouch is small. Now, if I ask you that, can you live on a capacity of 30 cc volume? If I tell you that you cannot eat more than 30 cc of pizza or anything,
Yes, it'd be very difficult.
it's difficult.
But what doesn't that widen after a time?
That is the thing.
Mhm.
Keeping the patient on very tight restriction, very small pouch, you can eat just a little amount of food, then your brain is not satisfied.
Ah.
Then you want to eat something else,
Mhm.
but you cannot eat because it doesn't go down. The outlet is tight.
And that's fixed permanently. It doesn't widen.
We try to fix it,
All right.
but patient tries to widen it
I
because
see.
you want to eat.
Yeah.
So unlike in MGB where the outlet is already wide, here the outlet is wide. But in Roux-en-Y the outlet is tight. So the patients tend to dilate this outlet, which gradually happens in many patients
Yeah.
because it's just like leather, it dilates.
Mhm.
And that is the reason. Now you must have heard about a new surgery that's called as Fobi's ring.
Yes, because.
Fobi's pouch. They put a ring on this. So you can say it's a banded bypass now.
Mhm.
Put a band on the bypass so that patient cannot dilate it. But again the problem is that your brain wants more but you cannot eat. But here you tell us, how do you feel? When you eat, you
I can
get
stuff my-
satisfied?
Yes, eat all day long, which I think is a bad thing, though, doesn't it? In a sense, because.
That is what,
Yeah.
you know, we people earlier have been thinking that patients should be restricted too much so that you should not be allowed to eat. All the bariatric surgeons think like this, that these obese patients, they are naughty, they want to eat.
Yeah. Well,
So
it's
stop
natural,
them from
yeah,
eating.
Yeah.
But what we see practically, they gain weight.
Mhm.
Roux-en-Y patients, why they gain weight? Because they dilate the opening.
Or
and then
they can
eat.
they can liquefy chocolate and sauce and get them to make it easier to get
Yes,
through, like
that is the reason.
the
So
bands,
if
so
your
they can take in
brain,
the calories.
if your
still.
brain is not satisfied, then you want to eat something else. Ice cream can go down,
Very easily. Jelly,
sodas can go down,
gelatine,
jellies
yeah.
can go down. So the soft calorie failure is
Milkshakes,
much more
chocolate milkshakes,
with
yeah.
Roux-en-Y and other restrictive surgeries like sleep.